This is our ethical presentation. We did ours on resource management in healthcare. It's by Megan Peterson and Logan Strasberg. So what does resource management mean? If a patient is medically futile or in a vegetative state, the cost of maintenance is high for these patients. At what point do we draw the line and redirect these resources to patients for whom they could be truly life-saving? How do we balance what may be perceived as a financial decision against what is an entirely personal decision to a grieving family? When it comes to clinging to hope for survival for a loved one, no resource is properly spent. Finally, as nurses, we are in charge of maintaining a big picture perspective while simultaneously dealing with intensely personal situations on a day-to-day basis. Case studies that we found to come up with the idea of resource management was vegetative patients that are on a ventilator, have no chance of survival, are taking up resources as well as funds that could be put towards a patient that has high chances of living. Another case study that I found was that there was an example with a patient and the patient's family. They demanded to continue medical or surgical care, but the physician believed that the patient would not benefit from the further attempts of curative therapy, but they ended up going ahead with the procedure, and just as the physician had thought, the patient didn't recover that great from it and actually died from the procedure. So in cases like this, I think that educating families on saving their money instead of having these procedures that aren't going to benefit them.
Alright, so different pros to life support would be increasing the chances of survival for these individuals. This could give doctors the chance to continue to evaluate the patient and provide newly discovered treatment if there is any. There is always a chance that a miracle could happen in these situations. The second pro to life support would be to grant the patient and the family their wishes. Some people would have in their written will to specify that they would like to fight every minute of their illness regardless of the pain and suffering that they're going through. If they have life support written in their living will, then this should be honored by us. Number 3 would be to allow the families to come to terms with the death. Right away, patients' families want to initiate life-sustaining treatment and hope that their loved ones will live. Although, over time, they come to terms with the grieving process and realize that the patient is not going to get better, and letting go is easier after a time of anguish. So a patient, after a while, or the family is going to realize that they're just putting them through more pain in the end. Number 4 would be organ donation. This gives the surrogates the opportunity to help others by keeping their organs alive long enough to donate. This could aid in the grieving process of families and loved ones because they can feel happy knowing that they are helping another family. Other pros would be that there is a chance that the patient will regain consciousness. Traumatic brain injury refers to damage of the brain caused by external force such as a car crash or a fall. About 50% of persons who are in a vegetative state 1 month after a traumatic brain injury eventually recover their consciousness. So the patient may recover from a surgery well or in a way that the surgeon did not anticipate.
The flip side to this is the cons, such as prolonged agony. It's common that putting patients on life support only prolongs their agony. There's devastating side effects. There are many medical devices to aid patients in a vegetative state, but these devices can also cause severe damage. An example would be an NG tube placement can damage the lining of the esophagus, stomach, as well as erode the lining of the nasal passage. 3 would be draining of resources or money. Families Oftentimes, families are not able to afford the cost of treatment due to prolonged stay in the hospital and the need for daily care, medicine, and needs for one-to-one attention with a nurse or provider. Cons is also the ethical issues that come about with resource management or life support. These ethical issues include quality versus quantity of life. An example of this would be, are the families just holding on to the fact that their loved one is still breathing even though their quality of life is completely diminished? Or are they just holding on to the hope that their family member will come back and just regain normal functions in daily life? Another ethical issue that comes about with this is giving doctors autonomy. For example, if the family answers yes to the doctor's question of, do you want us to do everything to keep the patient alive? The family are setting themselves up for an ethical dilemma, as well as the doctors, because this causes the doctors to make decisions that may be unethical, such as the doctor may believe that putting a patient on life support isn't the best for them, but if the family members request that they, as a healthcare team, do everything to save them, putting them on life support is one of the options for that. The third ethical issue is withholding or withdrawing of life support. So when is enough for this patient? When is it time to shut off the machine and allow the patients to relieve themselves from the suffering? Another part of this is the economic perspective. The Urban Institute estimates that 22,000 Americans die prematurely each year as a result of being uninsured and unable to afford timely primary care that may have addressed a curable cancer before it became incurable. These patients who clearly could have benefited substantially from a timely health care, unlike PVS or a patient in persistent vegetative state. So just to reiterate, if a patient is on a ventilator, they are going to be in the hospital for a very, very long time, taking up beds and space and attention from these doctors and nurses. Whereas a patient that doesn't have as much income and they don't have space for them, they're sending money in a different direction than what it should be to help these patients who could recover and continue life in a normal way. There's a lot of money put into this, such as last year Medicare paid $50 billion just for the doctor and hospital bills during the last 2 months of a patient's life. If you think about it, a lot of this money that we're spending, $50 billion isn't that much in the healthcare, but it could save so many more lives than just a patient lying there in a bed with tubes and everything hooked up. An interesting fact that we found was that after several years, a PVS patient is more likely to die of old age or pneumonia than regain consciousness. This makes sense because when you're in these vegetative states, your immune system is so depleted that there's so many diseases floating around in these hospitals, so the chances of them getting them are very high, and their body doesn't have the ability to fight these off. So things like pneumonia can easily kill someone that is in these vegetative states.
So the ethical principle that we chose was justice. This is an ethical principle of fairness and equity according to equal rights to all and basing rewards on merits and punishment on guilt. So the nursing perspective of justice, this is that individual people and groups with similar circumstances and conditions should be treated alike. Fairness and equal distribution of goods and services should be for all people. So every patient has the right to receive care no matter the condition they're in. Also, patients have the right to receive care even if it's against the provider's best interest for them. All families have a right to give a loved one in a vegetative state and continually offer care, even if the care is not going to increase the quality of life for a patient. If the patient states in the living will that they want necessary care performed in order to sustain life, then that's what they should get. Patients should be able to get whatever they want in the healthcare, and they should be able to pick their plan of care and work alongside the doctors to plan that care. Other ethical principles would be autonomy, which is freedom. Patients have the freedom to choose the plan of care that they would like to receive. Also, the families have the right to decide their loved one's plan of care as well, and this is either putting them on life support or not. Beneficence is doing what is good. Providers and nurses are doing good to the patient by giving them their rights and allowing them to have a full life for as long as they wish. Providers can also suggest their opinion in these cases, even if it would be to not give care to the patient at all, like our case study above. Non-maleficence is doing no harm to the patient. Providers and nurses are able to keep the patient alive, not harming them in many ways. Veracity is telling the truth. Providers are able to be honest with the family by telling them that they really did everything that they could to take care of their loved ones. And this can just give the families the comfort in knowing that everything that they could do, they did. Justice is what ours was about, and that's equality, just to reiterate that it's giving the patient their full rights. Fidelity is fairness. We're being fair by supporting the patient and being faithful to their plan of care. Confidentiality is privacy. The patient and the family have the right to keep their wills and plan of care private from anyone that they want, and they can disclose it to anyone they want as well. So, resource management outcomes.
For patients, this would be so that they have the ability to use medical resources in order to live their life to the longest potential. Outcomes of resource management as nurses and providers, this affects us because we are able to provide care for our patient as long as possible. Also, we do not have to live with the guilt of not exacerbating all of our resources onto this patient. And as a healthcare system, this really benefits them because they receive funds from healthcare insurances as well as family of these patients. These patients are in the hospital for a very long stay, and it's very, very expensive, so a healthcare system may not be against this because of all the money they're receiving from it. So this ultimately benefits them in a way. How this impacts us as nurses in the future, just a key message that we came up with is being an advocate for the patient and being respectful of their choices, even if it is against your own. Every nurse has the opportunity to make a positive impact on the profession through day-to-day advocacy for a patient. So this could be if a family really wants to put their loved one on life support, as we have to be an advocate for them and make sure the provider is well of this and just set everything up in order to give that plan of care. Or, I mean, if even an advocate for them, it could be emotionally, like just letting them know like what to expect and that there isn't a very good rate of survival from this. So just making sure that they come to terms with that. This people on life support helps build effective patient-centered care teams. A lot of providers are going to be dealing with these patients on a day-to-day basis, so letting them know what's going on from a day-to-day and keeping everyone informed because it's a big team effort for these patients. Every patient has the right to live life, and it's something that will never change, so it's important to remember to treat each patient equally and with hard work because everyone is equal. So if this was your family member, how would you react? And just putting yourself in patients' shoes every single day.
So our ethical challenge at hand would be the money that we are spending towards palliative care and resuscitative care is hurting those who could receive more funds from the government in order to save their lives. But on the other hand, all patients have the right to their full potential of their quality of life and living as long as their body allows them to. And here's our resources page. Hope you enjoyed our presentation.
Peace out. Have a good Friday.
See ya.